Hi, my name is Stephanie Apt, and I know just how confusing the world of health insurance can be. So today I'm just breaking down what your options essentially are if you're shopping for an individual health insurance plan. So, when most people come to me wanting a new individual major medical insurance plan, they essentially have two main options. There are a couple other options that I'll mention at the end, but most people decide to go either one of two ways when it comes to buying an individual health insurance plan. And the first option is getting a qualified health plan. Now, a qualified health plan is what most people think of when they think of a health insurance plan. So it meets the Affordable Care Act guidelines. So it includes all those essential health benefits. It covers all and every pre-existing condition. There is no medical underwriting. You don't have to answer any health questions to apply. And it covers all of your preventative care at 100%. Things like well checks, routine physicals, vaccinations, routine preventative screenings, those are all covered at no cost to you per the Affordable Care Act guidelines. It also covers maternity care, mental health benefits, pediatric dental and vision benefits. Those are all going to be built into qualified health plans. And most qualified health plans are eligible for tax credit savings if you can qualify based on your income and your household size. Now, qualified health plans are generally more expensive, especially if you don't qualify for a tax credit, because they do cover all pre-existing conditions. You know, there's no medical underwriting. They take anyone, whether you're sick or healthy, so the rates are going to be a little bit higher. And also, most qualified health plans have very limited, smaller networks of doctors that you can see. So they're going to typically be HMO or EPO types of plans. And I want to explain a little bit about what that means. So with an HMO plan, you have no coverage out of the plan's network. So you can only use doctors and hospitals that are, on that list that take that plan. And with an HMO plan, you must establish a primary care physician, and you need referrals from your primary care physician when you want to go see a specialist. With an EPO plan, it's kind of just like an HMO plan. You can't go to any doctors that are not in the plan's network. The network is going to be limited to your region, typically, your state, your county. And with an EPO plan, however, you don't need referrals to see a specialist generally. Now, the other option that you have is to do a short-term major medical plan. Now, new legislation has made it so you can now again purchase kind of a long-term, short-term major medical plan. So starting October of 2018, you can purchase a 12-month short-term major medical plan, and then you can continue to renew that up to 36 months. Short-term major medical plans don't meet the Affordable Care Act guidelines, so they don't cover pre-existing conditions. That's the real biggie. Not going to cover any pre-existing conditions. They do usually require medical underwriting. There's a few plans that don't, but most plans require you to answer a series of health questions in order to qualify. Also, these plans don't include any maternity benefits. You're not going to have your preventative care covered at 100%. But these plans are generally less expensive because they do require medical underwriting. So you have to be able to health qualify for these plans. They're able to keep costs down because of that. And also with short-term major medical, you can typically get a really large network PPO plan that lots of doctors accept. Now, with a PPO plan, it stands for Preferred Provider Organization. You can go to any doctor you want and you will have coverage. However, you will pay less, lower deductible, lower copay, lower cost share if you're using a preferred provider. And generally, there's a lot more doctors in a PPO plan network than in an HMO plan network. So if you live in Central Texas, which is where a lot of my clients are, that's where I am, and you want a qualified health plan, there are only 5 companies in 2018 that even offer qualified health plans. And they are all HMO or EPO plans. And we reviewed what that means. So they're all going to be those closed network plans. Coverage will only be, in Texas or in Central Texas. Those will be the only in-network doctors, and you only have coverage if you're using an in-network doctor. I do want to mention that with HMO and EPO plans, you do have emergency coverage nationwide. So if you're traveling, people always ask, what if I'm traveling and something happens? If you have a true life-threatening emergency, you will have coverage anywhere you are. It will be covered as if it's an in-network service. However, you can't just go to the doctor because you have a cough and you're in a different state and expect that to be covered. It has to be a true emergency room visit. Now, in Central Texas, most plans are offered on and off exchange for qualified health plans. So on exchange means it's offered through the healthcare marketplace. You can find the plan on healthcare.gov. And if you qualify based on your income, you could get a tax credit, which is a government subsidy that's going to help you pay for your health insurance plan. And based on your age, your income, and your household size, that's how they'll determine how much tax credit you're eligible for. And then your monthly premium due to the insurance company can change accordingly. Off exchange means that you're buying the plan directly through the health insurance company. You're not going through healthcare.gov. Whether you go on or off exchange, you're still going to find, the HMO and the EPO plan networks. It's going to be the same. There's often a misconception that, well, if I go on exchange, way less doctors take my plan than if I go off exchange. But really in our area, it's going to be the same type of HMO and EPO networks, whether you're going on exchange or off exchange. So some questions to consider when you are making your choice. Do you need coverage for any current medications or any pre-existing conditions? If you do, you might want to look at a qualified health plan. If not, you may save some money by going with a short-term major medical plan. Are there certain doctors or hospitals that you want to keep in network? That's a really important one, especially if you're going with qualified health plans. You do want to know which doctors are important to you, which hospitals are important to you to keep. And also, are you comfortable paying the full out-of-pocket cost until you meet the plan's deductible? So in other words, are you comfortable paying a lower monthly premium, but knowing that you have to maybe pay a little bit more when you go to the doctor's office or if you need a medication? Or would you rather pay a little bit higher monthly premium and know that you just have a set copay every time you go to the doctor, every time you go pick up a medication? These are some of the questions that you just want to have answers to in your mind, and that'll help you narrow down what plans are going to be the best for you, your needs, and your lifestyle. If you have any questions or you need any plan-specific information for your area, please feel free to reach out to me. You can call me at 888-465-9728. During the busy open enrollment season, the best way to reach me is email. You can email me 24/7, Stephanie@aptinsuranceenagency.com. Thank you so much for watching. I hope you found this video helpful, and I look forward to helping you soon.